Hey, it's Chris Byer.
Chris Bowling. What's up, CB?
Hey, CB. We've got a special guest from Assured Partners, Katie Selz, joining us from our Wisconsin team. Katie, good morning. You want to introduce yourself?
Good morning. Thank you for having me this morning. I am Katie Selz. I am based out of Middleton, Wisconsin. I'm an executive vice president of employee benefits. Been in the industry for about 22 years. So I'm really excited to talk on this topic today.
Awesome. Thanks for joining us.
Excellent. Well, I know there's a lot of discussion that Chris and I have had about how do we help our employees at our client companies find the right access to medical care? How are they making the good decisions? You've touched a lot on some areas where you've just got to be an advocate for yourself, some best practices probably to make sure that even ourselves or our clients and their employees know how to navigate healthcare the right way. I know you've got a few topics you wanted to cover.
Absolutely. I feel like, as we've seen changes in the marketplace, changes in deductibles, changes in care, provider access, it's always really important that no matter where you're covered, how you're covered, that you're your own advocate. So it's really important to educate yourself, understand
Yes.
your health benefits, understand your condition if you're diagnosed with something,
Yes.
understand your access to care, utilizing the resources all around you. There's many resources. We have lots of technology that
Yeah.
we didn't have 10 years ago. So
True.
using those resources, not using WebMD, using the actual viable resources through your health carrier are really important. Keeping a
Oh, I think
detailed
that's
record.
important.
Yeah.
Yeah,
Absolutely.
absolutely. And I mean, just having the resource through your carrier, I would say 90% of the carriers that we work with have some sort of my chart or a way to log in that has those resources.
Yeah. Well, I think that we've had so many, health systems merge, doctors retire, new, primary care, as you said, keeping records is important because you've got to know what's going back to your childhood, care and things like that. Keeping that all in one spot has been a little bit more challenging but at the same time, like you said, leverage that provider's database, make sure you get your records transferred. I think those are all good things.
Absolutely. And yeah, keeping those detailed records. I laugh many years ago going into a provider's office with a condition that they could not figure out what was going on. And my mom made me carry around this big three-ring binder with all of the resources and everything,
Yes.
which nowadays it's right in your hand. But it really taught me to be my own advocate, to know what's
Yeah.
going on and to ask the right questions.
Yes. So what
And
is that like when you're in care with a doctor? What do you say works well when you're in that visit that would help somebody be a good advocate?
doing the research on your condition. So, again, not just necessarily leaning on, the Google searches,
Right.
but doing some deep dives of your condition and seeing there's so many different platforms out there, groups that you can be involved with and social media to get the right questions to ask the doctor. And
Yes.
you definitely want to lean on that provider that's caring for you, not necessarily just the peers, but they can really guide you to the answering those or asking those right questions with your provider.
You bet.
Yeah. What do you
And
have
I
next?
next, so communicating that, don't hesitate to ask those questions and seek a
Yeah.
second opinion. Sometimes it comes to a situation, and I've had clients coming to me going, I don't know what to do. I don't
Yeah.
feel this is right. You know you better than anybody else. If it doesn't feel right, any situation or any decision we make, if it doesn't feel right, get that second opinion, make that
Yes.
call. And no doctor is ever offended with you getting a second opinion. Sometimes they encourage it. They want you to
Yeah.
go get that second level, and maybe a connection with this doctor is different than one that you might be able to connect with on a
Yeah.
different level. So don't be
That's good to
afraid to ask
remember.
for a second. Yeah, absolutely. And then also with prescriptions too, when it's easy to accept when a doctor prescribes you a prescription, even if it's something that you're maybe not keen on taking. Do the research on that. See if there's
Yeah.
any other avenues you can ask your doctor to do. So if there's a step program that you can maybe diet eliminating or work in some other directions rather than
Right.
jumping to an injectable $5,000 drug right away.
Yeah. Well, I think we don't do a great job of asking the right questions or asking for those other opinions or just saying why. I think a lot of people get intimidated by the fact that's a doctor
Cool.
sitting in the room with me when it's their job to really help educate you if we take the time to ask the questions.
Yes.
Absolutely.
I think what I learned from Carrie, who's been a nurse for 30 some years, is number one, these doctors are so overwhelmed. The chances that they have the ability to understand every single drug is very challenging.
Yeah.
And now that we advertise,
Yeah.
now that we advertise drugs, now these doctors are under more scrutiny that you want this
Yeah.
drug, and I better give you this drug, or now you're going to ding me, and then my ratings are going to go down. But yeah, I can't
So true.
get to know their nurses as well as you get to know the doc, because they're the ones that are really advocating for you, because docs
Yeah.
just don't have the time anymore.
Absolutely. And
Yeah.
that's key too. Opening the, kind of going back to the communication, keeping that communication.
Yeah.
A lot of our carriers have options or providers where you can my chart them or you can message them.
Yes.
Message those questions as they come to you. And don't necessarily wait for that office visit, because a
Yeah.
lot of times that can be triage outside of an actual physical office visit.
Right.
Yeah.
And there's so many different commercials out there for prescriptions, and sometimes it's quick for us to jump to those commercials.
Oh, yeah.
And we all know
Yeah.
sometimes that's the most expensive drugs that you're leaping to. So
Right.
yeah, really getting a feeling for, all right, is this the right treatment plan for me? And you're not second guessing the doctor. You're not saying,
Right.
hey, I don't have MD behind my name, but it's just being a little bit more conscious of, your healthcare and taking care of
Yeah.
yourself. We do it with purchasing a car. We do it with anything that we purchase. Why don't we do it with our own bodies every single day?
Yep.
Yep. Makes sense.
And then kind of leading
And then
into,
what was your last one? Yeah, go ahead, finish it up.
yeah. So know your rights. So understand your rights
Yeah.
as an individual, as a consumer, as a patient, understanding that you can go ahead and ask for that second recommendation. And in conjunction with that, understanding your insurance policy, where's
Right.
my limitations? I'm not going to jump outside of my network, but is there anybody I can utilize within my network that can get me? So really knowing the plans and what's protecting you, because too often I'm seeing that individuals are jumping outside of the network because they all of a sudden are
Yeah.
like, I heard this doctor, without making those right steps. And now they have a financial burden of, I have a $10,000 bill that's not covered. So,
Yeah.
asking the right questions again, making sure that you're getting the right direction from your insurance. If it's not covered, they can find you a second option that might just,
Yeah.
be able to get you on the right path. So again, it's just really knowing yourself, taking care of yourself, and taking those additional steps, and kind of looping everything in, taking that second peek of any of your medical bills you get, just like a credit card statement, something might
Yeah.
slide in there, an extra cost. Take a second look at those. They're generating them so fast sometimes,
Right.
and they're going based on what they're receiving from the doctor's office. So just always take another peek, make sure that everything looks thorough with, the backside with the insurance.
Love it.
Good reminders. No, I think it's good, Katie, just to think back through this, not only for our own personal health, but also, again, what we can advise our HR teams to help educate their employees and their families on how to access care. Well, CB, as we're coming up on time, I know you've got your question to ask.
All right, Katie, you've either had a good day or a bad day. What's the quote? What's the motto that gets you through that day?
Well, the motto, especially when it comes to this, is taking charge of your health is the most empowering step you can take. Advocate for yourself because no one else knows you or your body better than you do.
Amen.
Well said.
Well said.
Yeah, well said. Thank you, Katie.
Thank
Appreciate you
you.
spending some time with us.
Yeah, we'll see you,
Hey,
Katie.
appreciate it,
Take care.
guys. Thank you.
All right, take care.